Welcome to the Dr. Jason West Thriver Program.
All right, you guys, here we are. We're going to have an interesting show tonight.
To achieve and maintain optimal
That's
health.
right. We're coming at you with 100 years of experience. It's the Dr. Jason West Program, and we have had an array and challenges of technology. So I've got to get all of that worked out. It's working now. I'm so happy to be part of this. Part two of our series on, infertility and miscarriages, what you can do about it and stuff like that. So I'm just going to put that up on the screen. And if you missed the program or you missed last week, and then you can pick it up on drjasonwest.live. So no concerns about that. You can pick everything up. We're talking about a book and a resource and some other things. And really one of the things we wanted to talk about on this program is some of the things that you can naturally do for life to come into the world. So this is not in lieu or instead of medical treatments. This is actually things that help to build on what things we can do for building blocks and some other things. And so that's what we're going to be working on tonight. So infertility and miscarriages, a lot of focus tonight on male health. And obviously it's part of the equation for bringing life into the world. And what can we do for guys that need some balancing, some vitamin minerals? So that's going to be a huge part of what we're going over tonight. And also what we can do once life happens. So I got this question from one of our patients that was struggling with some infertility conditions. And then she was able to get pregnant. She's like, what do I do? And I'm like, well, you got to keep on what got you here. And what we're focusing in is vitamins and minerals and hormone precursors. And so that's what we're working on tonight. So without further discussions, let's get right into it. A quick shout out to our sponsors of the program, of course, the West Clinic. That's my clinic and my team over there. I've got some really gifted and unique healthcare providers and an incredible support staff that makes this show and everything happen. So I wanted to give a big shout out to them. My producer, Jordan, and his second sidekick Dalton. So appreciative of those guys making the show happen, and also our marketing director Macy. Give her a big shout out. Now, the other thing that is really fun to talk about in this program is the things that we can do to help people to improve their health, and that is by giving the body what it needs. So whether it's vitamin C, or whether it is detox therapies, or whether it's getting your body on a schedule, there's so many different things that it can be. And that's what we're going to be focusing on as well in this program, is how do you create an environment that is optimal health? That's so missed in many of the medical treatment programs. Is yep, we're going to use different things. I hear Clomid a lot. I hear different hormone therapies and stuff like that. But no one's talking about, all right, you got to get your emotions put together. You've got to get a stress pathway or stress regulation. All of that is part of the program. So, but our natural health specialist is personalized organs, tissues, and cells. And so we wanted to give a shout out to them for helping us to do different formulations and custom protocols and things like that. So infertility and miscarriages, we're going to do this. And then we're also going to have a free expanded version of what we're going over tonight, because there's so much to do and so much to cover. So that being said, here we go. Number one, last week we talked about estrogen and progesterone, and then some of the herbs that really help with that, and vitamin E as the sex hormone precursor, both for males and females. And what a sex hormone precursor is that's like taking your 2x4s, plywood, and sheetrock to a job site so that people can build the house. It's not a hormone therapy. It doesn't, in my experience, it doesn't interfere at all with any of the medical treatments or recommendations for male health and female health. I think it actually augments or helps those. So vitamin E, so important. The other one that is good for females and not so good for males is chaste tree berry extract. I've seen some really good, nice hormone modulations with chaste tree, but It is a libido reducer in males. So you want to make sure that some of the things that you give couples, like it's good for one, but not good for the other. So on this portion, we just want to do a real quick review. And again, if you missed it, you can pick up the replay on drjasonwest.live. I'm going to throw this up here real quick of where you can pick it up. That was our show last week. So let's start talking about how we can get people healthy. So one of my favorite things to recommend is you just got to put everything in balance. The ability to put things um, in balance and harmony is great. So first thing is for both males and females. I'm not discriminating this week. Last week I talked a lot about females. This week I want to talk about males. So here's what you do. You want to get a good baseline lab evaluation that almost every family practitioner health and wellness exam does, which is a complete blood cell count with auto differentiation and also a complete metabolic panel. Those are common things to run. We want to look at white blood cell health. We want to look at red blood cell health, hemoglobin, and hematocrit, and make sure all your red blood cells are healthy. We also want to look at the white blood cell count. It should be 6 to 8, and also neutrophils, lymphocytes, eosinophils, basophils, and monocytes. So we want to have those, be able to look at those. That gives you a really good baseline. Is everything balanced? That's number one. On top of that, if there's some hormone considerations, doing a thyroid evaluation using a T4 and a T3 and a TSH. So that looks at thyroid output and your protein levels for the thyroid and also how it's interacting with the pituitary gland. I think that's a really good baseline. A vitamin D level is good. A lipid panel is really important. And a lipid panel is basically how your body is dealing with cholesterol. And we want to check if it's too high, but we also want to check if it's too low. And then looking at total iron levels, uric acid, C-reactive protein. Like there's a really nice profile that you can build for both parts of this equation, male and female. Then looking at the male side, and so many men don't like to talk about this. So I'm really focusing on what we can do for the male partner and a difficulty conceiving or early miscarriages type system. Now, again, we just want to have a healthy environment for the baby to develop, etc. And that is, we want to make sure that we have healthy blood. And my favorite thing is a plant blood extract called chlorophyll. It has vitamin A, vitamin D, vitamin E, vitamin F, vitamin G, vitamin P, vitamin T. Now, a lot of those vitamins you talk about, people will be like, wait a minute, never heard of those. Well, those are the cofactors. It's the old school terminology going back. And what makes vitamin C work? Well, it's vitamin P. And what helps with calcium uptake? It's vitamin F. And what is really good for nerves and stuff like that is lipotrophic B vitamins, that we want to make all that happen. Now, that being said, we want to balance everything. I really like, there's specific hormone tests that you can do. My favorite one is the saliva hormone test. And I like that because it's not bound to transport protein molecules in the blood. So you can get, I think, a really better assessment. I'm looking at estrogen, progesterone, testosterone, DHES. Cortisol is kind of our baseline profile. And then we can want to talk about how to build men's health. Men's health, you work on vitamin E. We can use a plant blood extract called chlorophyll. We can add a hormone glandular component. It literally helps the body to give a DNA imprint to make healthy hormones and sperm production stuff. In my experience, in my opinion, I've seen some really good outcomes over the last 21 years. So that being said, with that, I like these natural hormone male health products if they have the chlorophyll and if they have a little bit of glandular product in it. Another one that I like that's really good for both parties, I really like cold processed natural wheat germ oil. It's good for menopausal symptoms, fertility conditions, acne, capillary conditions, cramps, hand scale, nail support. I haven't seen a lot of problems with wheat germ and in traditional celiac disease. So I don't want anybody that is concerned with celiac disease having, going just full bore on this. I think you want to be a little bit careful with this, but cold pressed wheat germ oil has some antioxidants, protects against, spontaneous abortion, sex hormone precursors in my clinical experience, and helps with iodine, thyroid metabolism. I see some really good outcomes with this. Now, one of the things that is really good about this too is it's so good for scar therapy, and it's really good for anything that is sclerotic in the body, and what that means, hard scars. I've seen some pretty good outcomes with symptom improvement in scleroderma and things like I think I see some good outcomes from that. um, I really, really like to prescribe and use this. Now, if you need a source of vitamin E, that's something that we can put together inside of our free book in a report that's over there at drjasonwest.life. I also see some really good outcomes for muscle health and muscle function when it comes to wheat germ oil. Okay, some other considerations for fertility is to make sure that you don't have too tight underwear. It's kind of funny to talk about, and when I say funny, sometimes it's really awkward when you start telling guys, "Hey, look, if you have the scrotum pushed up too hard against the body, sometimes it can get hot, and it's just not as healthy. I mean, too hot is what I meant, and it's not healthy for sperm count." So I've seen a lot of people coming in that have worked with a urologist and an infertility specialist, and that's one of the recommendations is to make sure that you have boxers and not briefs. And then the other one that I see, and we talk about this all the time, like it's a universal thing, vitamin D levels I see are really good for those conditions. Now, we had some significant technology problems and when we started the program. The camera didn't work, the sound wasn't working. We were trying to improve our set that caused us to get a little bit delayed. So we are doing an expanded version of this that we're uploading to drjasonwest.live just a little bit later that I would encourage you to check out. Right now, we want to cover these bases. If you are having concerns with difficulty conceiving, whether male or female, or maybe it's both, here's some really good steps for it. Eliminate processed and junk foods, reduce your sugar intake because it's inflammatory food, and increase your healthy and alive intake. If you're a male, use boxers, not briefs. You want to make sure that the scrotum on the male doesn't get too hot. You want to use some things that will help the body to increase natural hormones, the vitamin E, a wheat germ oil. There's some glandular things associated, like with bovine testes and bovine ovaries, that I've seen some reasonable outcomes with, and also having a really good stress outlet. So we're doing expanded version with all our technology working. It really was flustering to get started. I apologize for that. So check us out later on drjasonwest.live for additional insight, a free ebook, and resources for things that we can do to support your hormone health. That is our quick view of the program while we're getting ready to do an expanded version with all of everything working. Anyway, thanks for sticking with me. drjasonwest.live on Infertility Part 2, Male Health, and to see our expanded version a little bit later tonight. Everyone, here's to your energy, balance, and longevity.